I'm Shelley Abear. I'm Executive Director for Public Affairs at Stanford Hospital and Clinics. Tonight's topic is one that is especially important, not only to older adults, but to all of us. As we and our loved ones get older, it's essential that our healthcare environments support our changing needs. This is a very high priority for the design of the new Stanford Hospital, and we're very excited to be able to share some of our thinking and the state-of-the-art ideas that are going into that design. Since the existing facility was built in the 1950s during the Eisenhower era, our understanding of how healthcare environments can actually improve healing and reduce stress for seniors, for their families, and for their caregivers has advanced significantly. Tonight, we are very fortunate to have 3 national experts in hospital design and aging adult services to discuss designing healthcare environments to meet the needs of older adults. Each speaker will give a presentation, and then we will have some time at the end for questions and answers, and we appreciate if you would hold your questions until the end of the program. And then following the program, we invite you to join us for refreshments. Now I would like to introduce our speakers. First is Dr. Rita Gatak. Rita is a very familiar face to many here at Avenidas as an innovator, an advocate, and some would say a guardian angel of older adults in our community for many years. She is currently the Director of Aging Adult Services at Stanford Medical Center, and since launching the program, she has developed a unique continuum of care model with effective programs and services for older adults. In addition, Dr. Gatak teaches programs on long-distance caregiving, the aging patient, and dementia management at several colleges and universities, and she has presented in many national and even international forums. Dr. Gatak is also a consultant for elder care resources to companies such as Hewlett-Packard and Apple Computers. Betsy Brawley, our second speaker, is a leader in her field of environmental design for the needs of older adults, and she is president of Design Concepts Unlimited. With more than 30 years of experience as an interior designer and consultant for healthcare projects, she has gained national recognition as an expert in this area. In 1998, she was awarded the Polsky Prize for Outstanding Contributions to Research in Environment for designing for Alzheimer's disease, strategies for creating better care environments. In addition, Ms. Brawley is a special consultant to the California Governor's Task Force for Alzheimer's disease, developing environmental design guidelines for Alzheimer's care settings, and is certified by the National Council of Interior Design Qualifications, the California Council of Interior Design Certification, and the American Academy of Healthcare Interior Designers. Our third speaker, Dr. George Tingwald, is one of the very few people nationwide who are both a licensed physician and an architect. He currently serves as the Director of Medical Planning for the Stanford Medical Center Renewal Project. Dr. Tingwald has medical and design experience in all aspects of healthcare delivery, with special training in surgery and its ancillary services, emergency medicine, women and children's health, and the development of campus and hospital master plans. Throughout his career, Dr. Tingwald has focused on the special needs of large teaching and research institutions in diverse locations and with multicultural constituencies. He is on the clinical and architectural subcommittees of the AIA Healthcare Guidelines Revisions Committee and is a founding member of the American College of Healthcare Architects, where he serves on the Curriculum Steering Committee. Dr. Gatak will begin the program, so please join me in welcoming her.
Thank you so much, Shelley. Can everybody hear me? Yes? And I feel really grateful for this opportunity to share my thoughts and ideas here today. And what I will be doing is just discussing some of the protocols and parameters that we use to build the Aging Adult Services program at Stanford. And I'd like to start with this, a little thought for the day. And the famous jazz player who lived to be 102, and he said, if I knew I was going to live so long, I would have taken better care of myself. And I think here lies the basic premise of what is really aging adults, and what is the thought process, what are some of the medical technologies, and what is it that we are really facing today. As you know, that there has been an unprecedented demographic shift, and it says that nowhere in the history of civilization has there been such a demographic shift. There was no longevity, and medicine and as well as technology has really enhanced. And so I think that just between us here, therein lies a huge responsibility among each one of you and among the healthcare team to create an infrastructure for aging adults. We didn't live this long before. We didn't have medications tested on aging adults. And all of this creates a huge, huge need. And most of my patients I work with, our program runs 24/7. They will come and tell me, Rita, I don't want to hear the word geriatrics. I am not there yet. And I say that, you know, it's true, because geriatrics is a very, very new discipline, simply because we didn't live this long before. But it is also true that there is positive optimism about the aging process, and the fact that there is so much out there in terms of prevention and understanding that we never knew before. One of the research and the data that all around us shows us that more aging adults will be living longer, will be living alone, have multiple conditions, and take multiple medications. And I think that is a fact that is absolutely one of the biggest problems that we face in the hospital today. I want to spend a couple of minutes on this slide. I have spent 20 years of my life in this field, and I think to me, transitional care is probably the most important one. I came to study gerontology at Stanford because my parents in India did not have any of the vision that geriatricians have today in treating complex diseases. And as you know, geriatrics still does not exist as a science in many developing countries. So transitional care is for any one of you who starts going to the hospital more often, starts taking more medications, goes from the home to the hospital, hospital to the home, home to a skilled nursing facility. All of these are transitions. And I think that it's so important to note what's going on in these handoffs and transitions, and that's what helps us keep in mind, you know, healthy aging and reducing the return to the emergency room and maybe taking better care of yourself. In response to the emerging needs of aging adults, Stanford has created a one-of-a-kind program called Aging Adult Services. And I would just like to tell you a little bit about this program. This is one of a kind in the United States because most hospitals have a geriatric unit or a geriatric program. This program really looks at a range of different aspects, and I'm going to explain what that is, and hospital design and hospital layout is very much centric to that. So Aging Adult Services was started in 2004 under Guest Services, and thanks to our visionary leaders, Martha Marsh, our CEO, and Barbara Ralston. And it is a unique model to address healthy aging and the multidisciplinary needs of aging. The program with its team and medical director has a patient-centered approach. So let me explain what is it that we do. So we created a program because we saw the need. We saw patients who got discharged from the hospital, went to skilled nursing facilities, and then realized there wasn't much of a communication with the skilled nursing facility and the hospital. Then they went home. By the time they reached home, they were a different person because they had more medications, their condition had changed. Did they ever go back to the primary care doctor and discuss their changes? Did somebody go out and see if they were set up for safety? Did somebody give them preventive methodologies about how to exercise, how to get well? All of these issues were things that we were grappling with, and we wanted to create a kind of a continuum of care model at Stanford.